Hello, my name is Jessica, and today I'll be talking to you about tax status of healthcare organizations, which is Chapter 4. These are the learning objectives from the chapter here. What is tax exemption? Tax exemption is the status that allows an organization to pay no taxes, including sales taxes, income tax, and property tax. To be tax exempt, corporations must meet certain established criteria. The rationale for tax exempt status is that for-profit corporations pay taxes. This includes federal and state income taxes on income. Not-for-profit organizations pay no taxes, and they are therefore tax exempt. Why does the government grant tax exempt status to corporations? In order to relieve the government of the burden of providing the services itself. Reward the corporation for performing services that enhance community values and goals. Some examples are states grant healthcare organizations tax exempt status, and in exchange, the organizations provide healthcare services to state residents who cannot afford healthcare services so that the government won't have to do it themselves. Another example is an organization that provides uncompensated health promotion programs to the community and is granted tax exemption due to the benefit of the overall well-being of the community. How do you qualify for tax exempt status? In order to qualify, you need to operate exclusively for charitable, scientific, or educational reasons. Serve public rather than private interest in that the organization's income does not benefit individuals. Not engage in prohibited transactions, like for example, participation in political campaigns and attempting to influence legislation. The benefits and burdens of tax-exempt status for hospitals. Some benefits can be eliminating tax liability, eliminating the organizations from having to pay most business fees and licenses. Organization is able to issue tax-exempt bonds, and some burdens can be the fact that you cannot participate in political campaigns, influence like legislation, cannot lend any part of organization's income without adequate security and interest. You cannot make investments for more than adequate consideration. Cannot sell an asset for less than adequate consideration as well. Community benefit and tax exemption status. What is a community benefit? A term used by taxing authorities such as the IRS that refers to specific actions required from a tax-exempt organization to maintain tax-exempt status. There was a report by the Congressional Budget Office, which is referred to as CBO. They created a report on the provision of community benefit by not-for-profit hospitals. How did they do this? They took both for-profit and not-for-profit hospitals in 5 different states, including California, Florida, Georgia, India, and Texas, where they examined what the community benefit definition would be. The report definition of community benefit is that the provision of uncompensated care, the provision of services to Medicaid patients, and the provisions of certain specialized services that have been traditionally identified as unprofitable. This is CBO findings continued. On average, not-for-profit hospitals provided higher levels of uncompensated care and were more likely to provide unprofitable specialized services. And for-profit hospitals provided care to more Medicaid patients as a percentage of their total patient population and were found to operate in areas with lower average incomes, higher poverty rates, and higher rates of uninsurance. Judicial challenges to tax exempt status. So due to research findings, questioning emerged about the community benefits standard, yielding in courts reviewing the appropriateness of tax exempt status. Some of the cases mentioned in Chapter 4 was the Utah Supreme Court case, which argued that not-for-profit hospitals had evolved to a position making it impossible to distinguish them from their for-profit counterparts. Provena Catholic Hospital, Illinois Supreme Court denied tax-exempt status due to aggressive collection policies and using for-profit entities for key hospital affairs. Methodist Hospital in Houston tax-exempt status revoked due to failure to provide adequate charity care. The ruling rationale for the Utah case, which I found very interesting, was that under this court's rationale, the amount of community benefit provided by the not-for-profit hospital should equal or exceed the amount of the tax exemption. In this case, community benefit did not equal the tax exemption, and the court required the not-for-profit hospitals to pay the difference in taxes. This created some controversy because critics of this decision argued that the community benefit standards were too lenient. IRS challenges to tax exempt status. In 1987, due to the public pressure, IRS began to tax audit exempt organizations, including healthcare organizations. By the end of 1992, the IRS had audited 233 tax-exempt healthcare organizations. Frequently reported from these audits was that inappropriate physician recruiting arrangements and taxable unrelated business income. In 1994, a hospital in Houston agreed to pay nearly $1 million in federal income taxes and penalties in response to IRS allegations that the hospital had offered lucrative physician recruitment and retention incentives, including signing bonuses, income guarantees, free office space, malpractice insurance, equipment loans, and loan guarantees. Action taken by the IRS. An audit program for tax-exempt healthcare systems called the Coordinated Examination Program, which is now referred to as CEP, for Coordinated Industry Case Program, was created. What does CEP do? It uses an interdisciplinary audit team of specialists in corporate restructuring, pensions, payroll taxes, income taxes, and tax-exempt bond financing. What do CEP audits examine? They examine the community benefit standard, which has been an issue, unreasonable compensation and private inurement, financial analysis, joint ventures, independent contractors, legislative challenges to tax-exempt status. There has been challenges throughout all the years, but has significantly related to tax organizations in the late 20th and early 21st centuries. The Tax Bill of Rights II indirectly addresses tax-exempt issues. It provides intermediary sanctions the IRS must take before revoking an organization's tax-exempt status. The overall goal is to provide community benefits to the communities involved. Changes added by our IRS to tax-exempt hospitals. The IRS added a Schedule H to Form 990. Schedule H has actually 6 parts addressing how the tax-exempt hospitals provide community benefit to their communities. Part 1 is the most important part and represents several types of financial assistance. The 6 parts are as follows. Part 1 is financial assistance and certain other community benefits at cost. Part 2 is community building activities. Part 3 is bad debt, Medicare, and collection practices. Part 4 is management companies and joint ventures. Part 5 is facility information, and Part 6 is supplemental information. So what happened after this? In 2009, Senator Grassley convinced the Democratic majority to include many of the reforms in the Affordable Care Act. Why did they do this? Tax-exempt hospitals don't have many measures of accountability for their special status, and the law hasn't given them much direction, so they've defined standards for themselves. What are the Affordable Care Action requirements? To complete a community health needs assessment and implementation strategy every 3 years and make it available to the public. Develop, implement, and publicize financial status policies. Limit charges to patients eligible for assistance to no more than the lowest amount billed to insured patients. Avoid extraordinary billing and collection activities until eligibility for financial assistance is determined. Are most nursing homes tax exempt? Majority of nursing homes in the US are for-profit, so around 68%. Main states with more for-profit nursing homes than others would be Texas, Oregon, California, Louisiana, and Oklahoma, having the highest rates. States in the upper Midwest have more not-for-profit nursing homes. For-profit nursing home stereotypes. Does the type of ownership of a nursing home affect the quality of care? A common stereotype is that for-profit and chain-operated nursing facilities tended to devote fewer resources to direct patient care, resulting in poor quality of care for residents. How is quality of care evaluated? The quality of care evaluated is evaluated by structure, which can be defined as resources or staffing, process, which are actions in which they provide care, like restraining a patient, outcomes and results for patients. They might be bad outcomes like pressure ulcers, or at times it can be good outcomes as well. What does research say about not-for-profit nursing homes? Not-for-profit nursing homes have, on average, lower hospitalization rates, fewer cases of pressure ulcers, and lower rates of restraints. Patients appear to heal better in non-profit nursing homes and are more likely to return to their own homes after a period of healing. My thoughts on this is that even though studies have proven that care might be different in profit and not-for-profit organizations, it is not the case for all facilities. It can be different in every single one. Should a patient looking for a long-term care facility take into consideration the tax-exempt status? I believe they should, but don't allow that to be the only judgment when choosing a facility. The right thing to do is to visit a facility and see how the facility is ran by the staff, the food, care, and overall culture in the facility. Unfortunately, the negative stereotypes can cause an impact on most for-profit facilities. This can cause a large issue for administrators when trying to run a facility. Most of the long-term care facilities I worked at were for-profit, and I didn't find it an issue in care as far as their tax-exempt status were. And then chapter key points. And the discussion questions at the end of the chapter, which some answers are on this PowerPoint here. And this is the references I used. I did use the Nowiki book, but I also found 2 other references for this PowerPoint presentation. Thank you.